been a little while. We got a good number of people too, so
I'll come on this side.
yeah. Do we have Mark Luckner, Ebersol? Excellent, excellent. Come on in. All right. Let's see if we have everyone here. I think we do. All right. Good afternoon, everyone. It is a pleasure to be here with you all, with a number of distinguished guests and consortium members. Last year, in September, we stood in this very room and announced the beginning of a request for proposal process, a process that would ask community-based behavioral health care grants that would go directly to support pre-K to 12 students across all 24 of Maryland's jurisdictions. I'm happy to report today that largely due to the work of everyone in this room and behind me here, and members of the Maryland Consortium on Coordinated Community Supports, something I continuously have trouble saying, we are announcing the awarding of $111 million in grant funding to 129 child-serving agencies statewide. The need for access to behavioral health services for pre-K-12 students across the state has never been more acute. Never before have young people faced so many challenges in such a rapid, short period of time. The stress and strains that dominate a young person's life today, be it social media, the pandemic's effect on learning or socialization, have undoubtedly harmed our children. When you add in the recent rise of AI and the challenges our youth have faced are becoming more and more complex each month and each year. That's why today, I am hopeful that our historic investment in Maryland's school-age children for behavioral health services will have an immediate and positive impact in the coming months. During the 2023 legislative session, the Senate passed our comprehensive behavioral health package. I said then that it is imperative that we recognize the mental health crisis is just as crucial as physical health, especially in the context of education. As a former educator in the classroom, I've seen the need for services firsthand. Today's $111 million grant funding announcement is a substantial investment in our children's well-being. I'll never forget being in school, the days that students had the hardest amount and were about to have a blow-up or a concern. It wasn't because what was happening in the classroom, it was what the issues that they were bringing in. It was something had happened at home that they brought in and led to a great deal of consternation. And for the rest of the day, it was off. It's this type of dealing with one's own emotional stability and health that we will truly be able to invest in young people and see them maximize their God-given potential. I truly want to thank each and every person on this stage, particularly Consortium Chair David Rudolph, a former state delegate, and former Senator Ed Casemeyer, my former chair of the Budget and Tax Committee, who chairs the Health Resources Commission. I also want to thank the Secretary, who I will welcome up in just a moment. But it's this continued coordinated work to improve access to behavioral health services for children throughout the entire state that will be absolutely essential to their long-term success. Without further ado, I'd like to introduce our next speaker, Maryland Department of Health Secretary, Dr. Laura Herrera-Scott. Secretary Herrera-Scott.
Hello. Thank you, President Ferguson. It's an honor to join you today. I'd like to thank President Ferguson, the Consortium on Coordinated Community Supports, and the Maryland Community Health Resource Commission for providing this remarkable support to young people of Maryland. Because without stabilizing their behavioral health, they won't be ready to learn. And this really, really helps to stabilize children in school and their families. Your leadership in championing the blueprint and your recognition that support for health needs to be part of our vision for education is visionary. And without everyone here today, this announcement would not have been possible. As was already mentioned, 129 grants totaling more than $111 million will be put to use helping children who are struggling with mental health or substance use, while also providing resources to suicide prevention programs that serve Maryland's youth. And while we stand here today to celebrate, we are even more excited about sharing these grants with our community partners. This funding will help provide our educators and counselors with proper resources they need to help our children. This includes after-school programs that teach social and emotional skill building, instilling in our youth stress management techniques, coping skills, and relaxation training. These partnerships provide critical resources for struggling teenagers like therapy, psychiatric rehabilitation, substance use treatment, and family education. Our next generation can grow with the tools they need to overcome personal challenges, especially those that can sometimes lead to tragic outcomes. Under the Blueprint for Maryland's Future and with the great work of the consortium, these grants help us ensure that students throughout Maryland have equitable access to needed behavioral health services. And on behalf of Governor Moore and Lieutenant Governor Miller, I want to thank everyone in this room as we all share in the vision to leave no one behind. And with that, I'd like to turn it over to Chairman Rudolph.
Good afternoon, everyone. When I was a school principal, this today would deserve a shout out. People would be yelling and screaming about the positive thing that we have done. Starting today, we're awarding these grants to the school systems throughout this, to providers throughout the state of Maryland, from one corner to the other, not leaving students behind that need our help. And when you think about 18 months ago, when the Senate President and the House Speaker asked me to serve as the chairman, this was a very tedious work. And thank goodness we've had 25 committed individuals from out the state of Maryland who thought about serving on a consortium dealing with mental health. Mental health that impacts every school, every county of the state. And as previously stated, the $111 million that we have awarded, I believe very seriously will have an impact on our students, on their success, and on their lives. And I want to thank personally the people who served on our, have served and will continue to serve, because this is just the first phase. From here on, we will be monitoring our progress and moving forward. But the people who have served for past 18 months with me deserve all the recognition, because they took a concept and made it a reality, and a reality that's going to have an impact on those kids. So on behalf of myself and the staff that works with us from the department, I want to thank my consortium members for a job well done and finished the first phase of our efforts. Thank you, and it's my pleasure to be here today.
I believe we next have our representative from the House of Delegates, the one and only and excellent Delegate Eric Ebersol.
Tell me who's next so I can introduce them, please. I haven't a clue. Hello, everyone. So, like the president, I have a history in teaching, and nothing makes me happier than to be assigned to this consortium to help students with their behavioral health. No part of public policy hasn't been touched or affected by the pandemic. And our education policy has, in my opinion, and I believe in everyone's opinion here, been the most profoundly impacted. When we passed the blueprint in 2020, and I'll add parenthetically, they were some of the most exciting days I've had in the legislature. Just before the impacts of COVID were clear, we understood, even then, the need for a consortium of health supports to address students' behavioral health needs and, by doing so, improve their readiness to learn. Too many young people in Maryland are falling through the cracks. These are the words of Speaker Adrienne Jones. Those cracks she refers to have only grown wider and more difficult to navigate in the last 4 years. It is undeniable that we are facing even more behavioral health problems and challenges now than we did before the pandemic. I'm thankful that we in the legislature had the foresight to create the consortium then, as it is even more acutely needed by our students now. Proud to serve on this board that has worked with alacrity and with fidelity to vet and award these grants. I am sure our students will benefit and will be more available to learn what their behavioral health needs are addressed and ameliorated by these grants and the awardees who enact them. Thank you very much. My good friend Ed Casemeyer is next. He's other things too, but he's my good friend.
Thank you, Delegate. I'm Ed Casemeyer. I'm Chair of the Community Health Resources Commission. Excuse me. I just want to say two things. One, I want to thank the legislature for giving us the opportunity to develop these plans and develop a strategy to treat all the children that need behavioral health and wraparound services. And most importantly, I want to thank Delegate Rudolph and the entire consortium for getting the bare bones of a concept and putting together a plan that will work throughout the state. And this is just not a short-term thing. We hope this will be long-lasting, 15, 20 years to give all the care that our kids need. And I also, as Chairman Rudolph said, want to thank Mark Luckter and his staff who've done an outstanding job supporting our efforts. Thank you. Senator Hester will now speak.
Thank you very much, Senator Casemeyer, and I'd like to thank Chair Rudolph for his leadership on this consortium. As has been said, our kids' mental health was a serious concern even before the COVID-19 pandemic. Since 2010, the suicide rate among teen boys has doubled, and among girls, it's tripled. And today, suicide is the leading cause of death among teenagers in the U.S. But with this $111 million, we're going to put a stop to that. It's so important that Maryland is expanding access to high-quality behavioral health services. And I wanted to add just a bit of context to the blueprint that's been talked about. When we're in the midst of passing the blueprint, there was a bipartisan group of senators who worked on an amendment to help our local school systems to work in partnership with the surrounding communities. And although the name is long and cumbersome to say, it's really important that this partnership exists. We've worked together to accelerate state resources based on scientific and evidence-based solutions. And it's also important to note that the awards are annual. They ramp up to $130 million annually in 2026 and every year thereafter. So these grants are here to stay. Today, the $111 million awarded by the consortium demonstrates the state's commitment to improving mental and behavioral health. These awards reach across the entire state, from Washington to Dorchester and everything in between. There are several themes that stand out among these grants when I look at them in more detail. If you look at early intervention, there's a total of $26.6 million that have something to do with early intervention, because the easiest problems to solve are those that are caught early. Individual therapy and early intervention groups will now be offered in many counties, including Frederick, Howard, Montgomery, and Washington. Grants to support early interventions for learners with intellectual and development disabilities, as well as autism spectrum disorder, are our key focus for Prince George's County. There's over $25 million across the grants related to substance abuse treatment and recovery, so our kids can be in the right mindset to thrive. This includes at least one substance abuse program in almost every single county. Over $50 million go to some kind of family and parent support because our children's success starts at home. Dorchester, Howard, Montgomery, they all received funding for parent encouragement programs, education for parents and primary caregivers of children 5 to 18. And Frederick County also received a grant to provide school staff and parents training on intervention to address school refusal and avoidance programs. This gives me hope. I know that our kids will do better, and we have a brighter tomorrow because of this $111 million investment in them. And the grants will provide many of the tools they need to be their best selves, to be the light that the world needs now. In closing, I'd like to echo my appreciation for my colleagues and leadership in the Senate for making the funding available. I'd like to thank Chair Rudolph for your skillful leadership and Chair Casemeyer. And certainly not least, I'd like to thank the staff of the consortium and the consortium members behind me. We have had a lot of really long, nitpicky meetings, but the result is definitely worth it. Their expertise and dedication to our children makes the future brighter. And so with that, I would like to introduce Acting Superintendent Wright.
Thank you, Senator Hester. On behalf of the Maryland State Department of Education and Interim State Superintendent of Schools, Dr. Carrie Wright, I would like to express our appreciation to the Maryland Consortium on Coordinated Community Support for your support of the Blueprint for Maryland's Future. All factors influence a child's readiness to learn. When children are impacted by personal or family circumstances, they may find themselves distracted or exhibiting negative behaviors during critical learning times inside and outside of the classroom. Comprehensive supports such as health screening, family counseling, crisis planning, telehealth, and other wraparound services address these challenges from a holistic perspective. This generous investment will go a long way towards enhancing the overall teaching and learning environment for our children. I thank you to the consortium. I'm proud to be a member of the consortium, and all of our partners today for your commitment to ensuring a transformative path forward for every student in Maryland's classrooms and schools. Thank you to all.
Any questions?
Could someone just give maybe one example of what it would look like? Let's say you're talking about suicide prevention, we're helping out with children. Just a quick picture of what that would look like.
So I would, I'm sorry you did that. So we're not going to be providing it ourselves. The consortium is a pass-through. So the organizations that we've cited will address a variety. We didn't necessarily make them have to address, we didn't have a menu and you had to pick off of it. Chair, you look like you're leaning in a little bit here, and you can if you want to.
I can always lean in.
Well, come on in, come on in.
So if you have an issue, depending on what grade level, is that the consortium will be, concept is called hub and spoke, that the hub being the organizing figure in the county, and then they have providers going out to the schools, providing, depending on what grade level, services. So if a student needs assistance, it could come from the principal, could come from students' parents, to address the issues that they're facing. And that would be depending on what is being provided in that specific county. That answered your question?
Somewhat. Thank you.
How will you decide who is eligible for the money? How will it be decided?
How was it decided?
Yeah, who will be eligible for the money?
The grants are being announced today, were awarded last week, and that the people submitted grants this past fall, totaling 300 and some applications for being awarded. 119 of them were.
Oh, as far as the service providers.
119 service providers throughout the state. They will be the providers of the services inside the schools or outside the school, depending. Any student who.
Anybody that needs.
Yes, any student who needs it.
Can you
Yes.
Just to clarify, any student that needs it, is that regardless of healthcare coverage and things like that?
Well, that would all depends on whether or not we're going to be advancing the Medicaid coverage in the state. Hasn't been done yet, but that's I believe is going to happen, so that all students will be eligible, in the public schools who need services will be taken care of. Hopefully we can use the Medicaid in the future to provide even additional services for students.
But the services that are directly being funded by these grants will be available to all the kids in.
Well, students who need assistance, yes.
Right, okay.
Yes, ma'am.
Can you explain what type of monitoring parameters are put in place for these service providers to ensure that the programs are actually seeing success?
We've discussed that numerous times, but I certainly would do so. There will be a lot of data collected, a lot of information that each service provider will be responsible for developing. So we will be able to see, measure the success of these programs. And yes, it will be monitored on an ongoing basis. And we have a subcommittee. The chairman is here today, who's going to be working specifically on the issue of data collection and demonstrating that the program is being successful.
How often will the service providers be required to provide that data?
I think that one time at the beginning, it'd be like 3, then 6 months, 3 months, then 6 months, and on an ongoing basis.
And if they're not providing the services adequately?
And the staff will be addressing that issue, I assure you. Have an excellent staff who will be monitoring this program. And if it's not being successful, they will get a phone call from the staff, and if the has to, process will be taken to remedy the issue that is at hand. You can be assured that the staff is well aware that they have to monitor these programs to make sure they're being successful.
Mr. Rudolph, quick question. This grants, they'll be starting to be dispersed for this year?
Yes, right now.
And then, right now, and then going into next year from.
Yes, it's an 18-month grant to be able to provide services for the spring semester, summer time, fall semester, and then next spring semester. So if somebody got a grant, it's for the rest of the school year, the summer, and all of next school year.
And Dr. Wright, she is serving on the consortium. It's Dr. Wright, she's serving on the.
She represents the superintendent.
Oh, okay, just one minute, thank you, okay, thank you, appreciate it.
Any additional questions?
I have a question.
Yes, ma'am.
How did you arrive at that amount of money? Were you looking at a certain population, or did you see a demand and a need for a certain number of children and you said this amount of money will match?
The money was provided by the Senate and the House. So that's where the money was awarded. Then we put the grant request out, and then we stayed within those parameters to make sure that we only provided up to the money that we had. And we believe we've done a very good job in monitoring that, because we can't overspend state money. So therefore, the grants totaled that amount, and they were process that we followed to award grants and to make, some people did not, a lot of organizations that applied were not funded because we don't have the funds for every single one. But we think that it was based on the measurements after careful review of every single grant request by 2 organizations, and who reviewed them to make sure that they were qualified.
So there was 111 million, there was 120 million allocated, 9 million will be reverted. I think there was over $320 million worth of requests. So, you know, in a world of inexhaustible needs, at least $320 million worth of service provision was available, but we have what we have currently. We'll escalate over time, but we got to make sure that it's effective. It's got to be effective.
Yes.
Mr. President, how does it factor into looking at the future of the blueprint, the funding concerns, and the future of this program? Are you concerned about the possibility of these funds not being there?
No, I'm not concerned about that. I think that this is one of the most important investments we can make. So as long as I'm here, and I know a number of these leaders are here, investing in children's mental health is going to be a priority. And so, you know, what's important about this particular program is that we are making big investments in schools through school systems. This coordinated supports is outside of the school system. It's through providers, it's through the Community Health Resource Commission, and that is a very, very important distinction, because we want this to be a community-based service, not something that is just sort of stuck in schools, even though it will be supporting schools. It's the wraparound support that's needed in the community to make this effective. With that, thank you all very much.
See you, man.